The cold season has been here with us since the month of June, and it is expected to run all the way through this month of August. The cold season poses various challenges for our people, including our children and the aged, particularly during this period of COVID-19 pandemic. Seasonal variations, including extreme temperatures of both hot and cold, have been associated with increased morbidity and mortality among people with respiratory conditions such as chronic obstructive pulmonary disease or COPD. Cold seasons like winter can impact lung infections, lung functions, and even worsen the risk of infections. The risk of tuberculosis transmission appears to be the greatest during the cold months, particularly in overcrowded and poorly ventilated settings. There are several possible reasons as to why infections of tuberculosis tend to rise during this cold season. This is brought about by the lack of vitamin D, indoor activities, seasonal changes in immune function, and patient or healthcare system delays in the diagnosis and treatment of tuberculosis. During this cold season, the country has continued to witness an upsurge in COVID-19 cases, and being an infectious airborne condition, there are concerns of its rise during this period. This should be a clear wake-up call to all those with respiratory illnesses to take extra care, because it is in this period that the conditions can suddenly worsen. So given that cold season, already those with respiratory conditions are more susceptible to infection, and if you overlay upon that the ongoing COVID pandemic, you can see the danger that this can present to those with respiratory illnesses. Most people will tend to congregate in closed spaces in a bid to avoid the cold, while others will light fires in their houses to keep warm, particularly patients with asthma, COPD, and allergic rhinitis. Whereas it is important to keep warm, smoke can as well trigger allergic and asthmatic attacks, worsening the situations of persons suffering from those conditions. On the other hand, a poorly ventilated and confined room is a perfect setting for the spread of respiratory infections such as influenza, tuberculosis, and even COVID-19. Because of inadequate space for social distancing, if two or more people are living together. Ladies and gentlemen, I would like to appeal to our people to take extra precautions during this cold season by ensuring that they put in place certain measures that will ensure that they are not exposed to infections. This includes dressing warmly to avoid any triggers, keeping social distance to avoid respiratory infections, wearing a mask, which is very critical, especially in reducing transmission of infected droplets, keeping well hydrated by drinking lots of water and fluids, carrying out physical exercise. For those with underlying conditions, it is important to adhere to their prescribed medication, and we cannot overemphasize the need for hands and body hygiene. Seeking medical advice from our healthcare facilities in the event of any illness including experiencing difficulty in breathing. You realize that during the cold season we also have a number of the common colds and flus, and these conditions also share the same symptoms with COVID-19. So it is good to be alert and vigilant. If you see any of these symptoms, please seek medical advice. For those with chronic illness, make sure adequate supply of medication is available to avoid running out of this medication.